Hi, I'm Dr. William Kenholding, and I wanted to tell you a little bit about a treatment that we're offering, mindfulness-oriented stress inoculation training. I am a clinical psychologist in Wilmington, Ohio, and I work with children, teens, and adults, individuals, couples, and families. As I said, I'm a clinical psychologist. I'm also forensic psychologist, sports psychologist, and health wellness psychologist. The treatment that we're offering is mindfulness-oriented stress inoculation training, or MOSIT for short. And it's actually a combination of two best practices: mindfulness-based stress reduction training and stress inoculation training. Those are both best established practices that are focused on helping individuals individuals with stress-related illnesses be able to reduce their stress and improve their functioning. There's a teaching-based program that's focused on teaching the knowledge, skills, and attitudes that individuals need in order to modify lifestyles. And it is supportive and instructive in that regard. What MOSIT is not is it is not psychotherapy. So this is not a group for individuals with mental health related illnesses specifically. So this is not a depression or anxiety treatment group. This is, even though it does and can help individuals with some mental health related conditions like depression or anxiety, substance abuse, or eating disorders, that is not what it is specifically designed for. It is actually specifically designed to work with individuals who have stress-related illnesses. So in terms of the format of the group itself, it can be offered in a lot of different formats, but the format that we are using for this program is an educational group setting. And so in that educational group setting, we start out with an initial consultation with the patient just to check goodness of fit, what their expectations are. We do some pre-test measures just to really be able to show efficacy of treatment, and an orientation just so they know kind of what they're committing to, how it should work, and what they should be able to expect to gain from it. Then it is a class setting, group setting for 8 classes. They are weekly classes that run somewhere between 90 minutes and 2 hours. And we typically have somewhere between 5 and 15 participants for the group size. Following that 8-week format, then we have a wrap-up session, individual wrap-up session with the patient, just to, again, assess where they are as a post-test, answer any questions that they have, make any continued referrals that the individual might need at that point, and get their feedback in terms of treatment. In terms of who this treatment is really designed to work with, our particular program is designed to work with adults. Although this program can be used with teens and children, we're really looking at working with adults. If you have teens that are 16 or above that also have health-related illnesses, then they can be seen on a case-by-case basis for inclusion of the program. But it is really, in general, designed to work with adults. And they're for individuals with stress-related health concerns. So any type of illness, physical illness that is exacerbated or significantly impacted by individuals' levels of stress and their ability to cope with stress are programs that are conditions that are appropriate for this program. So anything from hypertension or cancer to diabetes and chronic pain works well in this particular format. It works well for this particular kind of treatment. Chronic pain, again, is a very effective. This is a very effective treatment for conditions like chronic pain, with or without secondary treatment like pain-reducing medication. This program works with individuals who are experiencing chronic stressors, so long-term stress, or acute stressors. This could be short-term, time-limited stressors. The stressors can be continuous in nature, or they can be intermittent in nature, and this program works well with with any one of those. This program does not work well for, what this program is not designed to work well with, are individuals who have lifestyle issues that are untreated in terms of untreated substance abuse or dependence. So again, if this is an individual who is not actively seeking treatment who experiences substance abuse or dependence and is not actively engaged in treatment for that condition, then this program and format does not tend to work well for them, and that may be cause for not including them in the group. Likewise, certain psychological issues that are left untreated. Again, so these are unaddressed, untreated conditions. If the person is experiencing extreme social phobia, not just I'm a little bit shy or I don't like talking in front of people, but phobic levels of difficulty in social settings that would make it so that they would not be able to sit in a group format. Likewise, extreme agoraphobia. If the individual can't leave their house, then group format tends not to work so well. Active homicidal, suicidal thoughts, active psychosis, major depression, or severe post-traumatic stress disorder, again, that is unaddressed. So these are individuals who are not actively seeking treatment for those conditions, are not really good matches for this treatment. Who have life conditions or physical conditions that make it so that they cannot attend the group. So individuals with lack of transportation or ability to get to the group, lack of resources such as childcare, any type of situation or attitudinal issues that make it so that they would have difficulty committing to coming to 8 groups. So that will be 2 months worth of treatment. People who are expecting a very quick fix tend not to work very well for this group. And kind of on that same vein, individuals who are unwilling to work outside of and in between classes, because this is an educational and experiential treatment where they have to do work outside of the session in order to really take advantage of kind of maximum efficacy with it. Individuals who are reluctant to do work outside of sessions, who are unwilling or unable to set aside, for example, 45 minutes a day where they can practice, up to 45 minutes a day where they can practice something, are not good fits for the program and tend not to get the best results. So the program, we have 2 different pay rates, cost rates, one for individuals who are insured, one for individuals who are paying out of pocket. For insured individuals, it is $125 for the initial session, and then $50 for each one of the classes. And then there's a follow-up assessment of $100. We do not have a true sliding scale, but individuals who are paying out of pocket or have extremely high deductibles, then we do have a discounted rate for those individuals, and that is $100 for the initial assessment, $35 for classes, and then $80 for the follow-up assessment. We are in network for some insurance, such as Anthem, United Healthcare, United Behavioral Health, and Aetna. We are not in network for Medical Mutual, for Ohio Medicaid, including CareSource, Medicare, Humana, and Cigna. We are not in network for them. So if this sounds like the kind of treatment that may be of benefit to some of your patients, we'd really like to have you contact us to make a referral. Those appointments can be scheduled by calling us at 937-383-3565. You could also fax or email the referral. Please make sure that you include the provider, the patient's name, contact information, insurance carrier, as well as the office making the referral and how to get back in touch with you. You can schedule the appointment yourself as the healthcare provider, or if you would like the patient to schedule, or you'd like to contact us with the referral and have us schedule that initial appointment, then that's fine. Either way works well. If you have further questions about the other services that we offer at Kennedy Consulting and Training, please feel free to give us a call. You can contact us on our main line at 937-383-3565, or you can contact us on our private line at 855-KC-TRAIN. That's 855-528-7246. Thank you so much, and we look forward to working with you in the future.